Hello, I'm Dr. Mark Gloth, Chief Medical Officer for Gilchrist. At Gilchrist, we help people live every moment, even when those moments become fewer. If you're wondering if you or your loved one may benefit from hospice, you should talk with your healthcare provider. Since most patients are referred to hospice far too late to get the full benefit hospice care can offer, I wanted to take some time to address some frequently asked questions about this comprehensive, patient-centered care. What is hospice care? Hospice is the model for high-quality, compassionate care for people with terminal illness. It's for people who want to focus on comfort and living every moment as best as they can for as long as they can, even when faced with an incurable disease. Hospice is appropriate for many patients with advanced illness whose focus is on comfort over cure. In that way, hospice is a philosophy of care and can be provided almost anywhere. Most people will receive hospice care at home, provided by a care team of professionals, for many weeks or months before they reach the end of their life. What about medical care and hospital visits? Do you give all that up when receiving hospice care? This is probably the biggest misconception about hospice. Hospice does not take away your access to doctor visits, appropriate medical and therapeutic treatments, or to emergency care. If you feel a medical procedure or hospital admission may still be necessary, one of our team members will walk you through the process to best move forward. Additionally, you can continue to see your own doctors while receiving hospice services. That being said, many hospice patients will choose to receive their care at home with a Gilchrist medical provider, rather than return to their primary provider's office. For those patients who elect a Gilchrist medical provider, the Gilchrist care team will work in partnership with your physician. Please also know that if at any time you decide you want to pursue more aggressive interventions, you can always change your mind and unenroll from hospice. What can someone expect from hospice care? In hospice, the focus is on comfort, not cure. Usually hospice care is focused at home, where people can maximize their time doing the things that they enjoy and spending time with loved ones. The hospice team are experts in treating symptoms and attending to other difficult parts of having an advanced disease, including emotional, social, and spiritual hardships. The goal is to maximize both quality and quantity. In other words, to live every moment as best you can for as long as you can. What will dying be like? How will patients and families know that the end is near? While you can't know exactly what the dying process will be like, for most people in hospice, it is very peaceful and comfortable, both for the patient and their family. Natural dying looks nothing like what is portrayed in the movies. Most people will show those telltale signs of dying, which the hospice team is likely to identify, giving loved ones the time to prepare. The hospice team will do their best to make sure caregivers have all the medications and equipment they need to ensure a peaceful and dignified death. Social workers and chaplains will be at the ready to provide the patient and the family with support, physically, mentally, socially, and spiritually. What if someone doesn't have familial, financial, or emotional support? Hospice patients receive financial coverage through the Medicare hospice benefit or through Medicaid. However, many private insurance plans also cover hospice services. In addition, the hospice team has many built-in supports for people who are in need. Social workers can work with patients to help with other financial concerns and legal issues, as well as provide counseling. Our team of chaplains and rabbis can provide social and emotional support regardless of your religious or spiritual background. Volunteers are also available to spend time with people who have limited family and friends. At Gilchrist, we have a remarkable group of volunteers, many of whom have experienced the support from hospice in their own lives. If you start hospice, doesn't that mean you are giving up? Hospice does not mean you're giving up on life. In fact, some people may actually live longer when their care is focused on treating symptoms to maximize comfort rather than spending their days pursuing invasive and sometimes risky medical interventions. In hospice, we want you to live every moment as well as you can for as long as you can. A person who chooses hospice care is choosing to honor one of life's most precious journeys. Dying is the final chapter of life, and we all must go through it. People who choose hospice get to write that chapter on their own terms. I hope that I was able to address some of your questions about hospice care. At Gilchrist, we are here to provide support to you and your loved ones. You will not go through this alone.